morning everyone. Today I will be presenting the topic absorption of minerals, how bioavailability of minerals shapes oral and skeletal health. So coming about the definition and importance, the bioavailability of minerals refers to the ingestion of the nutrients that is absorbed in a form which can be used by the body. In dental health, this concept is critical because it will be relying on the structural integrity of the teeth and of the bones, which relies on mainly calcium, magnesium and phosphorus. Adequate mineral absorption is needed for strong formation of enamel and overall dental health. Coming to the mechanisms of absorption, first it is of three types: passive absorption, active absorption and facilitated absorption. In passive absorption, movement of minerals will go across the intestinal epithelium without energy, driven by concentration of the gradient. Active will require energy. It is energy dependent process where minerals are transported against their concentration gradient, requiring help of carrier proteins and often influenced by vitamin D levels in the body. And facilitated is will have the diffusion process, which will involve the carrier proteins but no energy expenditure, dependent on the concentration gradient. Coming to the calcium phosphorus in enamel and bone mineralization, how this all will contribute to the oral health. First of all, formation of hydroxyapatite. The primary mineral component of the bone is the hydroxyapatite. It is a crystalline structure. It has a biochemical pathway for hydroxyapatite formation, which will start with the precipitation of calcium ions in the body and the phosphate ions also in the presence of hydroxide ions. Role of calcium. Calcium is crucial in the process where it requires the calcium ions that interact with the phosphate to form the calcium hydroxyapatite. This mineralization process is fundamental for the maintenance of the integrity of the teeth and the bones. Calcium is vital for the formation of the durable enamel, which is the hardest substance of the body, which will resist to the mechanical stresses and the chemical erosion caused by dental caries. Role of phosphorus. Coming to the role of phosphorus, it is supplied in the form of phosphate ions in the body and combines with calcium to form the hydroxyapatite crystals. Adequate phosphorus is absorbed by the body, which is essential to ensure enough phosphate is available for robust hydroxyapatite formation. This is only impacting the hardness and durability of the teeth, but also influences the density and the strength of the bone. Coming to the second mineral, that is magnesium, the contribution to the calcium and phosphate metabolism, how the magnesium is absorbed and how the enzymatic activity takes place. Magnesium acts as a cofactor in the body, and it is involved in the various biochemical pathways of the bone and the tooth mineralization, including the alkali phosphatase. This enzyme is pivotal for the mineral deposition of the bone and the teeth. It hydrolyzes in ester form to release the phosphate ions, thereby increasing the local concentration of phosphate available for hydroxyapatite formation. Magnesium and calcium utilization, how these both are utilized by the body. Magnesium influences the metabolism of calcium by affecting its absorption and regulating the parathyroid hormone, which plays a significant role in calcium homeostasis. Proper magnesium levels ensure the optimal function of the parathyroid hormone, thereby supporting effective calcium use in hydroxyapatite crystal formation. Coming to the regulatory roles of the vitamins and hormones, how these vitamins and hormones influence the absorption of the various minerals in the bodies. The vitamin D will play an important role in calcium and phosphorus metabolism. Vitamin D plays a critical role in the absorption of calcium and phosphorus from the intestine alone. It enhances the efficacy of calcium and phosphate absorption, ensuring the sufficient amounts of these two minerals are available for the tooth and the bone remineralization. Vitamin D actually activates the transcription of the calcium binding proteins in the intestinal lining, facilitating the transport of calcium into the blood. Coming to the role of the parathyroid hormone and the calcitonin hormone in the mineral absorption, the PTH is secreted in response to low blood calcium levels and increases calcium concentration by promoting calcium reabsorption. And in the kidneys, calcium released from bones, increasing calcium absorption in the intestine. Conversely, calcitonin is also secreted when calcium levels and phosphate levels are optimum for continuous tooth and bone remodeling processes. This biochemical interaction between the PTH and vitamin D forms the foundation for the absorption of minerals, and it will help in the structural integrity of the bones and teeth. These pathways are integral for the mineralization process overall and will ensure optimal bioavailability of these metabolic minerals, so that these minerals are properly absorbed. And how this can be enhanced by having a balanced diet and the supplementation of these minerals in maintaining the overall oral health outcomes. Now coming to the factors affecting mineral absorption. There will be various factors. First of all, dietary inhibitors, in which the phytic acid and the oxalates can significantly reduce mineral availability by forming complexes with calcium and magnesium that are not easily absorbed. Enhancers of mineral absorption, as talked before, vitamin D is crucial for the active transportation of the minerals of the calcium and the phosphorus as well as magnesium. Dietary proteins specific to amino acids can enhance mineral absorption by improving solubility and retention. Implications for oral health: poor bioavailability can lead to deficiencies which can have oral manifestations and therefore systemic diseases also. Coming to the pathophysiology and the mineral deficiency and the overall implications on oral health. So, coming to the dental diseases, if we have the magnesium, calcium and the phosphorus in low levels, we can have mineral deficiencies which can lead to the weakness in dental tissues and give rise to enamel hypoplasia, which is a predisposition to oral infections and periodontal disease. Coming to the most common systemic disease, which is osteoporosis, which will be having oral implications. Giving the overview of osteoporosis, it is a systemic skeletal condition characterized by reduced bone mass and deterioration of bone tissue, which leads to increase in the bone fragility and the bone becomes susceptible to fractures. The disease primarily affects the spine, hips, wrist, and also the craniofacial skeleton, including the jaw. What will be the impact on the alveolar bone? There will be decrease in the alveolar bone density. Reduced bone density in the alveolar ridge can lead to tooth loss, because it is having the foundation on where the tooth bud will evolve and it will give rise to teeth, and it becomes less stable. This loss of stability increases the risk of tooth mobility and tooth loss eventually. Coming to the bone, remodeling and reabsorption will take place. Osteoporosis accelerates the process of bone resorption, where bone tissue breaks down faster than it is replaced. This can lead to decrease in the height and width of the jawbone, affecting the aesthetics and the functionality of the oral cavity. For the implant placement, how it can impact the implant placement, it can lead to implant failure. Dental implants rely on the bone width and the height and the osseointegration process, where the bone tissue grows in and around the surface of the implant. In patients with osteoporosis, reduced bone density can impair this process and can lead to higher rates of implant failure. This diminished quality of the bone may not provide sufficient support for the implant, therefore leading to mobility and possible loss of the implant. Considerations in treatment planning, what we can consider. For patients with osteoporosis, dental implant treatment requires careful planning, history and proper taking of the systemic diseases where they have other comorbid conditions or not. Bone density assessments might be necessary before placing the implant. Techniques such as bone grafting may be useful in these patients where they have significant bone loss in the alveolar bone region. Preventive and therapeutic measures. Use of bisphosphonates in oral health. These are the commonly prescribed for the osteoporosis patients, which will help in increasing the bone density. The associations with them while they are using for side effects is rare, but serious conditions called osteonecrosis of the jaw can happen. So for the patients undergoing bisphosphonate therapy, particularly intravenous formulations, may have increased development of this after invasive dental procedures such as tooth extractions and placements. So overall dental management, they need a proactive dental management strategy with the integration of the all specialists sciences of dentistry to minimize the oral health complications. It includes proper history taking, dental checkups, periodontal management therapy, and minimize invasive procedures in these patients so that the best possible treatment is achieved. And for the bisphosphonate therapy, coordination between the dentist and the general physician is crucial to manage the timing and the approach to these patients. And enhancing the lifestyle and the dietary adjustments are needed, and less of tobacco use, less of alcohol can help to mitigate the effects of osteoporosis on oral health. It will overall bring out the general well-being of the patient, as well as the skeletal system will be having a good shape and condition. Coming to the enhancing mineral absorption for dental health, how these can be enhanced for the good absorption, strategies for improvement, dietary adjustment, reducing these inhibitors, the phytic acid found in cereal, grains and certain legumes, which will cause calcium and magnesium binding, which will be less, can reduce the absorption. We can take less of these cereals. Recommendation includes, if at all we are taking, we could take it in the form of soaking, sprouting or fermenting these, so that the phytic acid will be dissolved in the water, and then it can be taken in the form of food. So second is increasing enhancers. Increase the vitamin D intake for 4 weeks. After a period of 30 days, we can tell again to give for supplementation for 4 weeks like that. And supplementation, calcium and magnesium supplementation may be needed for the enhancement of these absorption of minerals. And clinical application, assessing the mineral status, routine mineral screenings for these deficient patients can help in the dental treatment, especially those with signs of bone density issues or chronic periodontal disease. This would involve having all the levels of the blood test to be administered to measure the levels of these key minerals in the body, and integrating findings into the dental care plans, personalized treatment recommendations with the help of all integrities of the dentistry for specific people. For example, if a patient has low bone density and suboptimal dietary calcium intake, recommend calcium-rich foods and possibly calcium supplement. Monitoring and follow-up is crucial and it is needed. And education and prevention is the last step of enhancing the mineral absorption. Coming to the last topic, what is the conclusion and the future directions for the absorption of minerals? So first, integrated care and prevention, emphasize holistic dental approach that integrates the regular dietary intake, counseling and preventing strategies focused on optimal mineral nutrition. Research and innovation, encourage longitudinal studies in these directions, and technological innovations such as the use of AI and systems to enhance the understanding of the effectiveness of the mineral bioavailability. Collaboration and education, patient education and collaboration, advocate for interdisciplinary collaboration and enhanced educational curricula in dentistry beginning from the very first year for comprehensive nutritional assessment and counseling.